Don't want you to catch the mumps, meningitis too, pertussis, hepatitis, or the flu. But everywhere I turn...
So vaccination is a big story at the moment. Here's one from last week. Delta Airlines is charging unvaccinated employees a $200 insurance fee every single month. Could it happen here? Joining us on the line to give us some perspective is a director at InsuranceMarket.ae, Rachel Al-Mahari. Rachel, good morning. Thanks for being with us.
Hi, good morning. How are you?
I'm really good, thanks very much indeed. And this story about Delta Airlines last week made headlines around the world because they are charging for every unvaccinated employee from October $200 a month surcharge for their insurance, because Delta says it costs about $40,000 to $50,000 per person to treat them for COVID. Could something like this, Rachel, happen here?
I don't think so. And I think it's for a number of reasons, actually. Can you hear me okay?
Yeah, I can hear you loud and clear, Rachel. So explain why you think it couldn't happen here.
Yeah, good morning. You can hear me now?
Yeah, absolutely perfect, Rachel.
Okay.
And you're looking great on Microsoft Teams as well. If you're watching on television, you can watch Rachel in full colour as well as hear her.
Goodness, that's scary. Is there a vaccine for that? I don't think it's going to happen here with regards to what's happening. Reason being, I think we need to think that Delta is an American company. And I think the reason that they've done that is try to stimulate the market. They've tried to get the vaccines up in the States, and obviously in the States as well. You have mandatory health insurance like here. But Delta, their insurance policy is actually a self-funded one. So what that means is they put money aside from their profits, and they take money from that profit to pay their own claims. So they don't actually have like a conventional insurance policy. It's called captive insurance. So it's a different proposition. What they're doing is trying to reduce their own claims outlay. So it kind of makes sense. What they're saying is, we don't want people to make a claim. So if they transfer that and say, listen, guys, you're going to have to pay for your own insurance costs and your own claims costs if you're not vaccinated, it's kind of the ultimate deterrent. So I think the strategy is kind of different. And would we see that here? I'm not convinced.
Okay, fine. But and a number of companies here have that captive insurance model, if you will. They maybe have a third-party provider who manages all the insurance claims, but they just pay them out themselves. It's not insured as such with a Zurich or whoever it is.
Yeah.
But legally, could that happen here for one of the big companies here or a small company? Could you say to your employees, you're not vaccinated, therefore your insurance premium's gone up, therefore you've got to pay that. I'm going to take it out of your pay packet. Could it happen here, Rachel?
I think it's conceivable it could happen. I think that's down to a commercial decision, what that employer would think. I mean, listen, at the moment, we don't have a federal law that says everybody has to be vaccinated, do we? I mean, it's still elective here, but the government have done a fantastic job from day one in protecting us, pushing us to do various things which we've all complied with. Vaccination is one of them, and we've now got the highest per capita vaccination rate in the world. So it shows that people really embrace the vaccine and they see the value of it. So I think from a risk perspective, we don't actually, in essence, need to do that. From an insurance company perspective as well, would that be seen as against human rights, for example, if we were to put it in employment contracts to say you have to be vaccinated? I don't think that would ever happen. Would it be that companies want to try and pass their cost on to employees? Yes, they might. We have other costs here that they ask us to subscribe to sometimes. You have varying degrees of contribution that insurers make here and that employers make here. So conceivably, yes, it could happen. Do I think it would happen, though? No, I don't think it would personally.
Okay, let's look at this slightly differently. In terms of the premiums that insurance companies are charging, let's take regular insurance, health insurance, for example. If you're a big company, I don't know, an Alpha Tame or an Emirates or a Procter & Gamble or whatever it may be here in the UAE, are the insurance companies differentiating between vaccinated and unvaccinated people in terms of premiums?
Currently, no. It's not even necessarily a question that's asked by all insurers. it's kind of a given that if something is out there, people will do it. So ergo, you couldn't deselect against people because it's not linked to federal law. A lot of what you do in insurance is linked to something underlying. So it's linked to a regulation or it's linked to a legal requirement, a federal law, for example. And currently at the moment, we don't have either of those. So for an insurer to say, hey, I'm going to charge you more money because you're not vaccinated, that actually would be against kind of public policy. Is that moral as well? That kind of thing. So at the moment, no. But going forward in the future, who knows? I mean, at the moment, COVID's still very much embryonic. Although it happened a year ago, we're not seeing the impact of claims yet because insurance typically runs on an annual cycle. So we don't often see the impact of the claims costs on the profit and loss account of the insurance companies till much later. And I think once that hits, then you might see higher premiums come into play. At the moment, the increases that you're seeing are quite minimal. They're quite staged. And we have the Insurance Authority in the UAE here as well, who regulate the industry. So they look to see that increases aren't unfair on the consumer. So at the moment, we're not seeing the impact of it. But if I was to have this conversation with you in a year's time, I think the landscape might look different. It really does depend on what the claims trending here is progressing. Is it going skywards? Is it plateauing, etc.? I think it's actually a bit more relevant in things like travel insurance, for example, where you do ask the question, are you vaccinated? Because there's a chance that person's going overseas, etc. They might come back with the COVID, then there might be a claim on that policy. So actually, currently in the health space, we're not seeing it so much.
But in travel insurance, we are. Are travel insurers now asking the question, are you vaccinated before they issue the policy? And is there a price difference for vaccinated and unvaccinated? Are we seeing that yet, Rachel?
No, what you might see is a restriction in terms rather than price. So you might see something like a higher excess, for example. You may, with some insurers, see a differential rate, but it wouldn't be huge. You'll probably be talking sort of 10, 15%. But again, a lot of that need on the travel insurance is driven out of the country that person is flying to. Is it a requirement that you have a vaccine for an immigration entry, for example? So a lot of what insurance does relates to kind of the commercial landscape in which it sits. Right now, you're not seeing directly linked increases, but what you are seeing perhaps are things like increased terms, like I mentioned, excesses. So if you're not vaccinated, maybe you have to pay a higher excess if you have to make a claim when you return, that kind of thing.
Last question from me, just 30 seconds on this one. Good friend of mine and his wife got COVID really in the early stages, March last year. They self-insure, they pay it for themselves. Thankfully, they both recovered. But they did see the insurance bill for them and their family increase significantly, the health insurance bill, because they had been COVID positive and had symptoms. Are we seeing this, that having COVID leads to a higher insurance premium?
Yeah, I mean, it's a reactionary thing. That's how it works. You know, it's the same like in motor insurance, where if you don't have a claim, you expect to see a no claims discount. Similarly, in things like health insurance, if you've made a significant claim, and obviously if there were multiple members in that family, as you mentioned, the claim cost would have been significant, then insurers would obviously look to recoup what they'd consider to be their loss. So yes, they would have seen an increase happen on that. So that's another reason for really having vaccinations, is to try and contain it and to therefore make sure that less of the population are making claims in order to keep those base premiums low.
Rachel, great talking to you. Appreciate your time this morning. Rachel Al-Makary is a director at InsuranceMarket.ae, talking about the impact of COVID on health insurance.
This is the Business Breakfast on